doctor's order to change your central line dressing. Let's see here. If you can just tell me your name and your date of birth. Okay, thank you. So, Mrs. Jones, how long have you had your central line for?
2.5 years.
Okay, so you're pretty familiar with how it works, right?
For the most part.
Okay, so you know that we're going to change your dressing every 7 days along with a cap change. And then we'll also do the a dressing change as needed and a cap change when we draw blood or lipids. You remember that?
Yeah, for the most part.
Okay. Perfect. So, Mrs. Jones, as you know, this is a sterile procedure. Do you remember what a sterile procedure means?
Just that you don't want anything contaminating my central line.
Yeah, so all the equipment I'm going to use is clean, and so it just reduces the risk for a microorganism to get into your central line and cause an infection, okay?
Okay.
And so I'm going to put this mask on your face, and so when we take your dressing off, if you need to cough or anything, or just hold your head away to the side of your dressing so that we don't have a contamination. And do feel free that if you feel like I might have contaminated something, touched my gloves on something dirty or whatever, just to say something. It's not a big deal. Let's see here. So I'm just going to take this alcohol wipe and just rub it on here for you. Help loosen up some of this tape here. And just turn your head away from me, from your area. Thank you. Just go ahead and take this off. So as I'm taking your dressing off, I'm just looking for any possible signs of infection. That would be like extra drainage, any kind of smell or warmth to the area. And so far it looks really, really good. Are you doing okay, Mrs. Jones?
Mm-hmm.
Perfect. All right, that looks really good. So I'm just going to go ahead and wash my hands again, and we'll get started with that sterile procedure. Do you have any questions before we get started?
No, I don't think so.
All right. So for the sake of this video, this would be a new kit. I just have my own gloves because they fit a little better. So I'm going to go ahead and get those on. we just have this extra mask, which we're not going to need. I have extra gloves in case we need them. And then this is just an extra sterile field. It expands the sterile field in case we need to do that. So I'm just going to go ahead and get my Tegaderm ready. Okay, I'm going to pop this and we're just going to go ahead and start cleaning. All right, we got that all taken care of. Are you still doing good, Mrs. Jones?
Yep, I'm okay.
Perfect. All right, and I'm just gonna date and time and initial this so that the next nurse knows when your dressing was changed and who by. There you go, and that's your dressing change. Thank you, Mrs. Jones.